Researchers from Harvard Medical School and the University of Miami examined the results of newborns' auditory brainstem response, ABR, a test that determines whether they have any hearing loss or impairments. Pediatrix Medical Group, which screens 850,000 newborns a year for hearing impairment in the United States, performed the ABR tests. The ABR is a simple test, part of the universal newborn hearing screening, that measures how well a baby's inner ear and brain respond to sound. The newborn's ears are covered with earphones that emit a series of soft clicks. Electrodes on their forehead and neck then measure the resulting brainwave activity. A computer records the responses and then compares them against predetermined response ranges. These sounds are soft enough that the test can be performed while the babies are sleeping, around 35 decibels normal hearing level. This is a significantly lower sound level than what is typically used during ASD screening. Although the purpose of this is to check for hearing disorders, it in fact allows you to have this cheap neurophysiologic experiment, says Kahan, who is the inaugural chair of the Department of Biomedical Informatics at Harvard Medical School and associate professor of medicine at Brigham and Women's Hospital in Boston. The ABR is a poor man's electroencephalogram, EEG. It was surprising to me that it could be picked up on a simple, 3-lead EEG as opposed to a 12 or 24-lead EEG, conducted in controlled conditions, he says.